All right, good morning to our Community Hospice family members. We're very excited to have you here today as we learn more about the coronavirus vaccine. We're very, very blessed to have Dr. Raible from the Stanislaus County Emergency Operations Center, who has been working on the front lines with the COVID vaccine here today to help us all learn a little bit more about that coronavirus vaccine and different facts and answer any of your questions that you may have. So I'm going to introduce our presenter, and after teaching for 10 years, Dr. Lyn Raible wandered off to medical school. She completed her residency in the county's family medicine residency program. Since then, her main time as a physician was spent initially as a clinical physician, then as a hospital physician, and finally as a physician treating opioid use disorder. She retired in June of 2019, but began working at the Emergency Operations Center a year later as the county was partway through its first COVID-19 surge. In that position, she has been a part of the I'm going to say this wrong, I'm sorry, the epidemiology team?
Epidemiology.
Thank you. Which she reviews medical records of all potential COVID-19 deaths, and the healthcare system guidance team. Having reviewed a lot of death, she is deeply committed to educating people about the importance of the coronavirus 19 vaccines as a method of protecting oneself and others against death from COVID-19. We are just very honored to have you here with us, and thank you for taking the time. And I'd like to remind everybody that please mute your cameras. If you have any questions, we will take them, but I do ask that you enter them into the chat box. I will be moderating that chat box and we'll make sure to address your questions at the end of the presentation. So with that, I'm going to go ahead and turn it over to Dr. Raible.
Thank you. I want to say, actually, to reiterate what Kristen just said, I've, over the course of this pandemic, especially the surge that we had through the holiday season, I've reviewed a lot of death. And the vaccine is something where we need to help people understand how they work and why we believe that they're safe and why they're important. Because without these vaccines, we would see no end to what we've been seeing. So this is really, really critical. And I really appreciate you giving me an opportunity to provide you guys with some information so that you can help other people understand about the vaccines. These vaccines, even though most of us have gotten vaccinations in childhood and other times, if we travel abroad to certain places, we have to pick up vaccines. You go into healthcare, you got to get a Hep C vaccine. Most of us don't think much about how they work. And so I will talk specifically about how the vaccines that we have available to us today for coronavirus work, and give you some other information in general about what we need to understand about coronavirus. So the first thing is to look, January 16th was the first time I gave the vaccine education talk. And so you will see in the lightest gray numbers, the January 16th in parentheses, and then the current information that we have on coronavirus cases and deaths is in bold. So we can see that as of last Friday when I updated this again, there have been 119 million cases of coronavirus in the world and over 2.5 million deaths. Right? In California, we have over 3.5 million cases and over 55,000 deaths. And in Stanislaus County alone, we've had over 51,000 cases and 963 deaths. Right now, it may not seem this way to you, but if we go back to just the last few weeks, we still have 2 deaths per day being reported to us. Right? But that's a lot better than January when it was 9 deaths a day on average. That's a lot of people in the county to be passing away. New cases per day back in January, the peak was 491 new cases a day. Now we're down to 66. So all of that's really good news. Plus the weather is getting better. People are less confined. Um, so how do we actually fight infections? The first thing I want to do is just point out that this is a picture of the coronavirus um, virus. And you can see there's elements of several different colors. One of the things that we're going to keep in mind through this presentation is that these colors represent different components of the virus. We need to remember that the virus actually has several bits and pieces, just like everything in an organism. So again, both viruses and bacteria have several components. Viruses aren't actually considered to be an entire organism because they don't have the ability to reproduce by themselves. When we have something that has several components and does not belong to us, we have white blood cells that can detect them, and antibodies that will detect these bits or components as foreign, as not me. And when a substance does that, we call it an antigen because it has the ability to cause us to produce antibodies. What's interesting is that we have several different types of antibodies, but the two main ones come from something called IgM and something called IgG. The very first antibody that detects things that don't belong there is the IgM antibody. And it's the larger one with several arms. The yellow ends there are things that detect things that don't belong, things that they can identify as not me. IgG, which is the second antibody to respond, is a much smaller antibody. So the problem with the IgM is even though it's the first to detect, it has no memory. So a week later, you could show the same thing to IgM and it'd act like it's brand new again. Well, that's a problem because it's not learning from experience. So we want something that actually learns and creates a memory of the invader. And then it keeps just a low number of soldiers hanging around, kind of keeping their eye out for this invader. And then if they spot the invader, it's the second antibody, the IgG, that rapidly increases in its numbers and really fights the infection. So that's the importance between having never seen something before and seeing it. So what does coronavirus do to cause infections? Well, before I give you that information, I want to talk about how our cells actually make things. Because the key to understanding the coronavirus 19 and its vaccine and how it infects us and how the vaccine allows us to fight is understanding these three things. The first is what's messenger RNA? What does it do? Where does it do it? And what happens after it's done it? So the common sense way of thinking about this, so I'll show you, this is the scientific way of explaining that. So the common sense way of thinking about it is that DNA rules the kingdom, it rules the cell. It lives in the nucleus and it never leaves the nucleus. It does not go into the cytoplasm. If the DNA wants something done, it sends coded instructions out into the cytoplasm, right? So it sends instructions to messengers that live outside of the palace. And once they get outside of the nucleus, outside of the palace and into the general palace grounds, there are people there who sit around and they decode messages. So the message gets decoded, gets translated, and then it's destroyed. I don't know how many of you are old enough to remember the original Mission Impossible, but I always liked the tape that just after it said, this Jim, is your mission should you decide to accept it. This tape will self-destruct and blah, blah, blah. So messenger RNA doesn't hang around. Why? Because our cells would explode, because we're getting messenger RNA, we're getting messages from DNA all of the time telling our cells what to do. So they're deactivated afterwards. And then depending on what the instruction was, it may stay inside the cell, it may travel to other cells and start processes there. But wherever those instructions arrived, then they're read and they're followed. So this says the same thing, just in a more technical looking way. We have DNA, we have it opening up in messenger RNA, actually getting coding and sending the message out into the cytoplasm, where it gets read and translated and turns into whatever, and then the messenger RNA is destroyed. So remembering that, how does coronavirus 19 cause infection? Coronavirus is a single-stranded RNA virus. What that means is that once it gets into our cytoplasm, it's treated as if it were messenger RNA from anywhere. There's nothing about it per se that causes our cells to initially go, well, wait, this isn't ours. Right? It just sees it as another coded message. Right? So there's no DNA in coronavirus. There are elements that allow it to get inside of the cell and into the cytoplasm, and then it's just translated like anything else. What it gets translated into are other things that then get sent out as messages that cause not good things to happen. But the other thing is that the messages about what they tell the cell to make end up with products where other things, centuries, etc., out in the body and the cells go, wait, this isn't us. This is a them thing. So even though the RNA from the virus is telling our cells to make certain things, our cells are then going, wait, this is not right. This is not us. We need to start to fight this. And so they begin to attack. But remember, if it's the first time that you've ever seen coronavirus 19, your body hasn't actually had time to make an army. And that's why it's important with a vaccine or even with a second infection. Then your body's already seen it, detects it more rapidly, and creates a stronger army to fight it more quickly. Okay, so how are these vaccines working? We now have two types of vaccines available. The first two I've been most familiar with, the Pfizer and Moderna. They're both messenger RNA vaccines. So they work the same way as the body's messenger RNA. They work the same way that the virus works. Right? So what we're doing is we're giving messenger RNA, and it codes for components of the virus. So if you're looking at like maybe one of the sets of instruction codes for bits that belong to the red fluffy stuff on the outside of the virus, another one maybe for the blue, and another one for the green. Both Pfizer and Moderna contain instructions to code for 3 different proteins that belong to the virus. The other reason to do it for 3 is, well, let's say we do it for 1. This virus mutates, and it mutates rapidly. If we do it for 1 and that's the one that mutates, we're out of luck, because there isn't, at this point, it's not going to recognize it anymore because it's mutated to the point that it's not recognizable. So when we have 3 things, that's what allows us to have broader coverage. When you get your flu shot, you actually are getting, you're actually going to be protected against a number of different components from assorted flus, depending on what flu we think is going to hit that year in the worst way. So these vaccines code for 3 different proteins. And again, once our body makes those proteins and they go out, then our antibodies say, well, wait, this isn't us, this is a them. We need to attack it. Okay. So important to understand, we code for 3 proteins. We know that these 3 proteins that the vaccine codes for cause antibodies to become activated. And so we get an immune response started. And then it's important to remember too, this is just a few sets of instructions. So it can't cause the coronavirus infection because it's not the entire thing. And we're not coding for proteins that can somehow cause bad things to happen in the human body. Okay, because this is messenger RNA or is viewed as messenger RNA, it can't enter the nucleus. Messenger RNA does not go into the nucleus. DNA does not leave the nucleus. Right? And again, because this is messenger RNA, once it's been translated and done its thing, it's deactivated. Now, newest to our armory is the Johnson & Johnson vaccine. And it actually is not that different from messenger RNA vaccines. It's just that it uses a different way to get the vaccine into the cell. And here it uses a harmless virus that can get inside of our cells to carry the instructions. After that, everything is pretty much the same. So in summary, and this actually mostly applies to the Johnson & Johnson vector vaccine as well. How does this work? Okay, you get pieces of messenger RNA that are used to create proteins that are the same as those on the virus. Your body uses this, learns about it so that it can attack and react when you're exposed. I think that you're apt to get questions about the different vaccines. And so, excuse me. So again, we have 2 messenger RNA vaccines, and then we have the viral vector vaccine. The nice thing about the Johnson & Johnson vaccine is it only requires 1 dose. If you look at the effectiveness, you'll see that the Johnson & Johnson vaccine, if you look at effectiveness against all coronavirus 19 infections, it seems less effective. But we have to remember that one of the differences between these vaccines is when they were tested in the general population. And by the time Johnson & Johnson was tested, we actually had a lot more mutation amongst viruses occurring. It's not at all clear that Johnson & Johnson is any less effective against all infections than Pfizer or Moderna would be right now. Right? We just have, because again, viruses, the reason we don't have a vaccine against the common cold is that the virus mutates constantly. That's what viruses do. So I would say that what we have is something that the most important thing is all of them are 100% effective against dying. And that's huge. Against severe infections, again, it's not clear that one is better or worse than another because they were tested at slightly different times against slightly different things. But the biggest thing is all of them prevent people from getting so sick that they die. So if you ask that kind of question about which one is best, as Dr. Fauci would say, and I'm a member of the Dr. Fauci fan club, the one that you can get is the best. It's also critically important as we go through the Johnson & Johnson vaccine from our perspective here at the Emergency Operations Center is critical because one of the issues that we've been battling with since vaccination started is getting people their second dose and getting it to them at the right time. And we have a fairly substantial population of people that it's difficult to get them both doses of vaccine. So we can now go into underserved areas where people don't have transportation, may even be somewhat migratory, and still vaccinate them and know that we can prevent them from dying from coronavirus. So that's something that's near and dear to my heart, is having that ability. And we're just waiting. We already have some Johnson and Johnson vaccine. We're looking forward to getting more of it. This is particularly important as we start moving into our the more migratory population of people who pick food for us in the valley, coming into the growing season. So, um, a lot of times people think, oh, did they just test these on these healthy young white people again? They didn't. They tested these. This was an international effort, and so all populations where they could pull people in the U.S. receive testing, not to mention elsewhere in the world. Some of the myths, the vaccine trials were rushed. I just want to reiterate this. If you hear this, it's like, no. What happened was that scientists and leaders across the world recognized that this was threatening the human population in general. And as a group, we weren't going to do well if we didn't have everybody on board and doing their best to fight this. So groups of scientists around the world focused on developing the vaccine. Scientists across the world shared information. Regulators across the world talked about and made sure that essential steps for the creation and testing of vaccines were carried out. They just streamlined the process so that some of the endless paperwork and red tape was not there. And scientists across the world assessed the risks and benefits of the vaccine versus the virus to determine that the approved vaccines showed substantial benefit over the virus. Another coronavirus 19 vaccine myth: the vaccine is going to give me coronavirus 19. Just like you actually can't get the flu from the flu vaccine either. So one of the things I wanted to say, though, is people often feel like they got the flu from the flu vaccine, or especially if you got your second dose from Moderna, you may feel like you caught coronavirus from it. But what you're seeing is actually something that you should view as favorable. That's your immune system doing what it's supposed to. The purpose of the vaccine is to educate and ramp up your immune response to coronavirus. So especially in a 2-dose vaccine, when you get the second shot, it's not uncommon for some of that activation to get to the point where you're releasing the chemicals that fight infection, but also cause things like aches and pains and fevers and chills, right? So it's good to warn people that they may have those kinds of symptoms, but that's just the sign that their immune system is indeed has learned about the virus and is responding to it. Doesn't mean that they actually have gotten the virus itself. Another way to help people understand is say, the vaccine will give me coronavirus 19. No, the viral vector and the messenger RNA vaccine codes for a few components, but not the entire virus, right? For a few proteins. So I can give you, as messenger RNA, the instructions to make a bumper, steering wheel, and a muffler. I haven't given you a car. You might wish that I'd given you a car, but that's not a car. It's just a few pieces of a car. And I can give you those instructions, and you won't know how to build the car from just those instructions either. So people often can understand that idea that I've given you a few pieces of something, but I haven't given you the whole thing. And that's what these vaccines do. Another one, again, it's going to get into my DNA. I've even heard some doctors say this, which is very disappointing to me. But DNA lives in the nucleus of the cell, and messenger RNA just does not go there. It has no way to get there. You might hear somebody who, I think that this has faded out as the vaccines have been around longer, but people say, oh, 6 people in the Pfizer vaccine trial died. I think, well, that's true. but 4 of those people were in the placebo group and got saline. 2 were in the vaccine group. So in fact, the saline looked like it's deadlier, but it's not. Why? Because the groups that we most needed to understand and be sure this was safe in are the elderly, because they're the ones who are most vulnerable to this virus. And those are the people that we are now vaccinating first. So we have to remember that the folks that we are vaccinating and that we're participating in a lot of these trials were an older population that have a higher mortality rate to begin with. So when we monitor to see if death is an adverse effect of this vaccine, what we're looking for is a clear death rate that is rising in the group that we're vaccinating. And we are not seeing that at all in the elderly population receiving the coronavirus vaccine. And so there's no indication there that there's something about this vaccine that is hurting them. And in fact, excuse me, in fact, right now their adjusted mortality rate is a bit lower. Why? Because the folks that aren't getting vaccinated are getting coronavirus, and some of those people are dying. Right now in the United States, there are a couple of cases of possible vaccine-related deaths that are under investigation, but right now there are no confirmed vaccination-caused deaths in the United States. Well, maybe we just aren't vaccinating enough people so that we can notice this. Oh, yes, we are. So right now, as of March 12th, in the world, we have now given 335 million doses of vaccine. In the US, over 98 million doses of vaccine. In California, over 1 million doses of vaccine. In Stanislaus County, over 100,000 doses of vaccine have been given. So we're vaccinating like crazy. If we move back and say, okay, well, how do we compare coronavirus deaths to vaccine deaths? As I said, we really don't have deaths, but let's also look at what happened if we didn't start vaccinating. What's the mortality rate per 100 people for coronavirus? It's 1.7%. So if you move down to the fourth, whatever, so if 1.7% people were dying from the vaccine, we would have huge numbers of vaccine-related deaths in the county, in California, in the US, and in the world, and we don't.
Dr. Raible, I do have
Yes.
a question.
Mhm.
Somebody just asked that that 100,000, is that single dose or is that both doses of the vaccination?
On the actual vaccination numbers?
Yes.
For anybody? So for all of these, it's just the number of doses given. If you want to know the number of people who have had both doses, it's about a third of that number have had 2 doses. And so 2/3 of that number are going to be people who've had single doses, if that makes sense. Well, or a third. So it does. Right now, it's easier to just count total number of doses and then total number with 2 doses. But if you want to know how many people have actually received both doses of vaccine, it's about a third of the number you're looking at.
Thank you.
And you're welcome. So, and as you notice, for us, one of the limiting factors have been just getting the vaccine. And certainly that's getting easier. We're getting more of that, but they're still ramping up production. But that's great. So if we looked at that, and if we look at, well, does somebody have an adverse reaction? You might have it to a first dose, you might have it to a second dose. Usually, if you're going to have a severe reaction, you have it to the first dose, not necessarily the second dose. If we look at all of this, what's the most severe reaction that we think about? We think about anaphylaxis, anaphylactic shock. So depending on which vaccine you're getting, the rate of anaphylaxis ranges from about 2.5 per million, not per 100 cases or 100 doses, but per million, to 5 per million. None of these people died. All of them recovered, and almost all of them had a history of prior allergic reactions. So they were already aware that they could react to this particular vaccine because they had prior reactions. So it's really important to look at that. And when talking with folks about the vaccine, especially, to look again at the mortality rate with COVID. 1.7 people per 100 cases. That's not good. And so people need to be reassured that we're not seeing bad things. When one of my neighbors was going to get his second shot, his wife said, well, that causes strokes because she had gotten online and that's what she read. But there's no evidence that any of these vaccines increase the risk of stroke. COVID increases the risk of stroke. Right? And so it's just important to provide assurance to people. The CDC has some great information. Refer people who are hesitant to the CDC website. Some folks aren't trusting the government. There's not a lot that you can do about that, but I still encourage them to look at those sites and explain to them why I trust the information that's on those sites. So why should you get the vaccine? Well, the traditionally listed reasons: protect yourself, protect your loved ones, protect those around you. But my thing, for me, an even bigger one, why else get vaccinated? For me, it's like, because I want to get back to normal. Right? I want, oh my God, we finally have a couple of friends who have gotten vaccinated as well. So we actually now, we don't eat inside, we're still eating outside with them, but at least they come over and we worry less. Right? So the other thing that we've seen in this county as we continue to be in the purple is that this is very damaging to small businesses. But the idea that the solution is to rip off your mask is wrong. It just means that we're violating guidelines. Taking your mask off and walking around without it doesn't help small businesses do what they really need to do, which is to stay open and serve a population without a lot of restriction. So what we want to do is encourage everybody to get vaccinated and help them understand that when they become immune, then the transmission rates within the community go down. And that allows businesses and schools and other things to open up. And so these are really major steps in regaining normalcy, not only for you, your life, your friends, especially if you're older like I am, um, but also for the businesses in your community. The other thing is that you're going to need to show your little vaccine card to do lots of stuff in the future. Right? And I know in this community already, we talk about how in certain events, what we'll do is require to get a ticket. You have to show that you've received your 2 immunizations. So know that these are likely things that at least some places are going to require. Certainly traveling outside of the country, there are countries that are going to require this. So there's just a number of ways that the vaccine is going to help you get back to a freer and more open life and travel. So it's really important, on top of protecting yourself, protecting your loved ones, and protecting those around you. And having read a lot of medical records and medical stories about how people got coronavirus and died from it, um, I would just say to folks who think that it, I think it's hard for people to understand how they can impact people around them that they don't necessarily even know if they catch coronavirus and don't know it but spread it. And we know, I have seen plenty of stories where the folks who passed had no idea where they picked up the coronavirus, felt they had been very careful, stayed home, didn't do this, didn't do that, and yet somehow contracted coronavirus, were in a vulnerable population and died. So encourage everybody to remember that our impact on people in any number of ways spreads out like ripples from a pond, and you don't necessarily know where those ripples go or how they impact things, but they do impact. And this is just so critically important. These vaccines are so very safe, and coronavirus is so very unsafe that this is the way to get our world back to where we want it to be. So tell people to get vaccinated.
Dr. Raible, I do have another question. It says, forgive me if you already answered this. Many people are concerned that there are long-term effects from these vaccines. Can you please touch on that a little?
What I will say is that the vaccines haven't been around long enough for us to know if there are some kind of long-term effect. There's no reason to believe that there will be, because if we go back to the messenger RNA, we're coding for 3 proteins that are found only on the virus, not on us. And once the messenger RNA is translated, it's deactivated. So it's hard to see that the risks from the vaccine would be any different from the risks from any other vaccine that we get. And but we're beginning to see now some of the longer term effects of coronavirus infection, especially in the people that we call long haulers. And those we're seeing pretty quickly. So I would say again that the coronavirus just poses a substantial and obvious risk. The vaccine does not.
Thank you. A clinical staff member said they have a patient that has pancreatic cancer that wants to know if they should receive the vaccination. Do you have any guidance on that?
My guidance on that would be the physician who knows the patient best should also weigh in on this. But at this point, the guidance would be to vaccinate the person, particularly because they have cancer, which makes them vulnerable, particularly if they are potentially immunosuppressed. But that's why determining whether or not when they can take the vaccine depends on whether or not they're currently immunosuppressed with medications. So that's why the oncologist or treating physician should be involved in that, to make sure that they are at a point where they can mount an immune response. It doesn't do much good to vaccinate somebody who's not doing antibodies.
Thank you.
So,
is there a way for someone who is planning to travel by plane and not in the approved group for vaccine to get vaccinated before travel?
Not that I am aware of. The good news is that there has not, despite what we would think, because airplanes always struck me as the vector for every known disease to humanity, but actually there have not been a lot of cases of coronavirus clearly contracted from air travel. My encouragement, if you have to travel and are not able to get vaccinated, is to wear a mask, wear 2 masks, bring lots of hand sanitizer and Sani-wipes, and just assume everything is crawling with COVID. And you'll probably be fine. The other thing that you can look at, depending on your health insurance and so forth, most places like Golden Valley is doing, most places that are doing vaccinations have a list, because at the end of the day, there are often just a few doses left in a vial, and if we don't use them, we have to waste them. So call around. As I said, I know that Golden Valley has a list like this because I just checked with them the other day. So call places like Golden Valley and other institutions that are giving vaccines and ask if you can get on the list. Normally, you have to be able to get there within a certain time frame. Usually it's 20 or 30 minutes. But check, because that is the one way that they don't care who you are. All they care about is that they're not going to waste a dose of vaccine. So that's another way to try to get vaccinated if you're not yet at the right tier.
Thank you. That makes sense.
Yeah.
Thank you. Would you mind touching a little bit in regards to masks, advice in regards to wearing masks after vaccination, or I know there's been a little bit of buzz in the community about wearing one mask versus double masking. Can you provide us a little insight in regards to masks?
I will. I think the first thing is masking after vaccination. Um, the advice is that you should do that for a number of reasons. The one time the CDC has said that if you are with other people who have also been vaccinated, you can meet without wearing masks. Right. And so, and for me, what we do with our friends is we meet, we're mostly outdoors, but if but you can be indoors, and we're less stressed. We still wear masks most of the time, but then we feel more relaxed when we're eating, where you can't wear a mask and eat. So, and the reason is, again, we don't know yet, because the vaccines are relatively new, as is this horrible disease. We don't know yet the number of times that people are going to pick up a possible coronavirus variant that isn't as well covered by the vaccine. So it may still, and California has its own variant, and unfortunately it's not nice. It's making people sicker and it's more contagious. So that's why we at this point just advise keeping the mask on, unless you're with people who are very socially distanced most of the time and have all been vaccinated. One mask versus two, I will say I have not double masked. CDC has found that double masking further reduces the risk of infection. But I work in a building where everybody is masked all the time, and there's hand sanitizer and sanitizer wipes everywhere. So I trust the people that I'm around. Plus, we have to go through our daily checklist if you don't have fever and cough and this and that. Um, if I were out in another area where I had more exposure to a general population that was variably compliant, which is true of our county, in case you haven't noticed, mask wearing really varies. And so the benefit of double masking is it just further reduces your risk. I would say one of the reasons I don't double mask is I always wear a medical mask. The cloth masks are what we call source control, which, and they're less effective than a regular mask like this, a surgical mask. And so I would say if you're wearing a cloth mask, then you might look at trying double masking, but I think two cloth masks would be pretty uncomfortable. My recommendation is to go with these. And then if you want extra safety, put a cloth mask over it.
Okay, thank you, Dr. Raible. And I do have an additional question, and it was, do vaccinating clinics have epinephrine?
Yes. They darn well better. Yes, they do. And that's why they have the 15-minute observation period. Almost all of the anaphylactic type or severe reactions they saw occurred in less than 15 minutes. And so the 15-minute wait, even after the second dose, is there just to make sure. And yes, there should be people sitting there with their little epi kit ready to come and stab your thigh.
Perfect. Okay, let's see here. Oh, here's another great question. There has been a lot of talk about breastfeeding moms or pregnant women being recommended to get the vaccine, or the risk, if any, should they be vaccinated?
Those trials are going on right now with pregnant women, but I will tell you that when we have pregnant staff members in long-term care facilities who want to be vaccinated, they are being vaccinated, and there has not been any adverse consequence.
Thank you. Okay, so at this time, I'd like to offer our community hospice family members here to ask any additional questions and give them just a moment. I don't see any other additional questions coming in. So Dr. Raible, I do want to let you know there have been numerous of our employees that have just been very grateful for your time and have shared their thoughts and their gratitude on the chat box. So without going through every one of them, we really extend our gratitude for you taking the time to educate us this morning and provide the information. It looks like there is one more question, and it says, how safe are the vaccines for children?
We don't have an answer to that because those trials have not been done. We recognized, we not being me at all, the scientific community, I should say, like I have anything to do with this. The scientific community recognized fairly early on with coronavirus that children, unlike most other diseases, children seem to be less likely to actually contract this. And if they do, our first thought was, they spread like crazy. For some reason, they seem to be less likely to spread it to others. And as we've heard a lot in the last year, they generally don't get very sick. That does not mean that some of them don't get extremely sick, but really, it's a very different thing for them. So the vaccine trials really focused on the vulnerable population. And now we're just moving on to the younger age groups. So we really don't know, but there's no reason to expect that the vaccine in younger people who already show much more resilience to this disease than we do, why the vaccine would somehow cause them more problems or any problems. But we don't have that data.
Thank you. Okay, so I see that you provided us a resource for the most up-to-date information. I did enter that resource into our chat box as well, so you guys can pull that website from the chat box for your own personal use. And then when we depart this meeting today, we did record this session and we'll have it available on our YouTube channel. So all of you are invited to go to our YouTube channel, that's Community Hospice. And you will have a recording of this video. If you have additional questions for Dr. Raible that you think of after we depart, please feel free to email them to me, and I'd be happy to pass those along to Dr. Raible as well to see if we can get an answer for you. So with that, Dr. Raible, just thank you very much for taking the time to join us this morning. We really appreciate all of your efforts and your knowledge and everything that you're doing to keep our community safe. And if you have any last words.
I always have last words. That's the problem with the person who taught for 10 years, is we never shut up. I would just say again that everybody, I want to thank everybody for participating in this. And I want to remind you that the people who make a difference in many ways in this county, in this country, are you. You are the people who have the power to make things better. And so thank you for acquiring information that you can use to help that happen.
Thank you. Great words of wisdom. Thank you very much. All right, with that, we'll go ahead and we'll end our session.
Okay, thank you so much.
Take care. Bye-bye.
Bye-bye.